brought to you by WikiVidi.com. Crack cocaine. Crack cocaine, also known simply as crack, is a free-based form of cocaine that can be smoked. It offers a short, but intense high to smokers. The Manual of Adolescent Substance Abuse Treatment calls it the most addictive form of cocaine. Crack cocaine is commonly used as a recreational drug. Crack first saw widespread use in primarily impoverished inner-city neighborhoods in New York, Los Angeles, and Miami in late 1984 and 1985. Its rapid increase in use and availability is sometimes termed as the crack epidemic. Physical and chemical properties. In purer forms, crack rocks appear as off-white nuggets with jagged edges, with a slightly higher density than candle wax. Purer forms of crack resemble a hard brittle plastic, in crystalline form. A crack rock acts as a local anesthetic, numbing the tongue and mouth only where directly placed. Purer forms of crack will sink in water or melt at the edges when near a flame. Crack cocaine as sold on the streets may be adulterated or cut with other substances mimicking the appearance of crack cocaine to increase bulk. Use of toxic adulterants such as levamisole has been documented. Synthesis. Sodium bicarbonate is a base used in preparation of crack, although other weak bases may substitute for it. The net reaction when using sodium bicarbonate is COCH plus Cl minus plus sodium hydrogen carbonate COC plus H2O plus CO2 plus sodium chloride with ammonium bicarbonate COCH plus Cl minus plus NH4HCO3 COC plus ammonium chloride plus CO2 plus H2O with ammonium carbonate 2 plus 2 CO3 2 COC plus 2 ammonium chloride plus CO2 plus H2O. Crack cocaine is frequently purchased already in rock form, although it is not uncommon for some users to wash up or cook powder cocaine into crack themselves. This process is frequently done with baking soda, water, and a spoon. Once mixed and heated, the bicarbonate reacts with the hydrochloride of the powder cocaine, forming free-base cocaine and carbonic acid in a reversible acid-base reaction. The heating accelerates the degradation of carbonic acid into carbon dioxide and water. Loss of CO2 prevents the reaction from reversing back to cocaine hydrochloride. Free-base cocaine separates as an oily layer, floating on the top of the now leftover aqueous phase. It is at this point that the oil is picked up rapidly, usually with a pin, a long, thin object. This pulls the oil up and spins it, allowing air to set and dry the oil, and allows the maker to roll the oil into the rock-like shape. Crack vaporizes near temperature 90 degrees Celsius, much lower than the cocaine hydrochloride melting point of 190 degrees Celsius. Whereas cocaine hydrochloride cannot be smoked, crack cocaine when smoked allows for quick absorption into the bloodstream, and reaches the brain in 8 seconds. Crack cocaine can also be injected intravenously with the same effect as powder cocaine. However, whereas powder cocaine dissolves in water, crack must be dissolved in an acidic solution such as lemon juice or white vinegar, a process that effectively reverses the original conversion of powder cocaine to crack. Recreational use. Crack cocaine is commonly used as a recreational drug. Effects of crack cocaine include euphoria, supreme confidence, loss of appetite, insomnia, alertness, increased energy, a craving for more cocaine, and potential paranoia. Its initial effect is to release a large amount of dopamine, a brain chemical inducing feelings of euphoria. The high usually lasts from 5–10 minutes, after which time dopamine levels in the brain plummet, leaving the user feeling depressed and low. When cocaine is dissolved and injected, the absorption into the bloodstream is at least as rapid as the absorption of the drug, which occurs when crack cocaine is smoked, and similar euphoria may be experienced. Physiological. The short-term physiological effects of cocaine include constricted blood vessels, dilated pupils, and increased temperature, heart rate, and blood pressure. Some users of cocaine report feelings of restlessness, irritability, and anxiety. In rare instances, sudden death can occur on the first use of cocaine or unexpectedly thereafter. Cocaine-related deaths are often a result of cardiac arrest or seizures followed by respiratory arrest. Like other forms of cocaine, smoking crack can increase heart rate and blood pressure, leading to long-term cardiovascular problems. Some research suggests that smoking crack or freebase cocaine has additional health risks compared to other methods of taking cocaine. Many of these issues relate specifically to the release of methylguanidine and its effect on the heart, lungs, and liver. Psychological. Stimulant drug abuse can lead to delusional parasitosis. For example, excessive cocaine use can lead to formication, nicknamed cocaine bugs or coke bugs, where the affected people believe they have or feel parasites crawling under their skin. People experiencing these hallucinations might scratch themselves to the extent of serious skin damage and bleeding, especially when they're delirious. Paranoia and anxiety are among the most common psychological symptoms of crack cocaine use. Psychosis is more closely associated with smoking crack cocaine than intranasal and intravenous use. Thank you for watching. Brought to you by WikiVidi.com. Please like and subscribe below. Please like and subscribe below.